While operating as Chief Medical Officer for Prudential Financial, I was faced with a very public suicide in one of our buildings, where an executive of a business jumped 4 stories in an internal atrium to his death. Although I never would have predicted this, I had developed a process with my team and the business to respond quickly to a crisis, any crisis. As a result, I was immediately notified and was able to mobilize my team to care for the family and the employees directly affected by this tragedy. Because of the strong foundation we had established, my team stepped in to meet this important need, and I was able to focus on preparing the president of the organization to navigate a successful response for his business. At the time of the suicide, Steve had only been in his position as business president for 2 weeks. He was still developing a working relationship with his leadership team and communicating his vision to his employees. Within 24 hours, I shared tailored analytics with Steve from our data warehouse that showed the emotional and mental health risk, medical utilization for mental health, and disability in his employee population. Steve and I worked with his team to evaluate the data, better understand what was happening in his organization, and develop an impactful response plan and identify action plans to address gaps. As a result of this intervention, disability occurrences tied to mental health decreased in his organization. His organization went from having the highest occurrence of all 13 Prudential businesses and corporate centers to being at the average. Emotional and mental health risk had significant improvement, trending towards the average. And Steve became a spokesperson for a culture of health. In his words, he had never experienced such a tragic event as a leader and never had such a clear picture of the path forward so quickly. Having access to the data and the expertise in less than 24 hours was unthinkable. Again, while we were sadly unable to prevent this tragedy, our quick response ensured those impacted by the event received the help they needed. I also had evidence that significant mental health conditions that could result in lost time and disability were avoided, as evidenced by the reduction in disability claims. This is just one example that demonstrates how a strong culture of health can have a positive impact on employees, leaders, and business. Now, as part of my role as an NEXTpert with HealthNEXT, we've now taken this experience and many more to develop a simple but effective employee health well-being benchmarking system for employers to assess the gaps from best-in-class emotional and behavioral health programs. This systemic measurement tool can reduce the time and cost of establishing an effective roadmap to workforce emotional well-being.